Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Luis here with us this afternoon. Luis came all the way here from Irvine, California, right?
That's right.
And Luis has been to other specific chiropractors who just adjusted certain areas and joints on his neck and his back and his low back, but Luis had numbness and tingling going all the way down to his left arm and hand and fingers, and they did carpal tunnel surgery on his left wrist, thinking he had carpal tunnel syndrome, but Luis still has numbness and tingling going down into your left arm and hand, right, Luis?
That's right.
And with these specific chiropractors that you went to that only adjusted certain vertebrae in your neck and your upper back and mid back and lower back, and they twisted you on your side, right?
They did the twist on the side
and you said that didn't really help you at all with your neck, shoulder pain, and chest pain you were having?
That's right, it hasn't.
And he gets pain out into his left shoulder and arm and goes around into his ribs, into his sternum right here. We call that cervical brachial syndrome. Now, I've already done his orthopedic neurological exam, and I'm going to show you a couple of highlights of that. But first, we're going to look at his posture. Let's have you flex your head forward and backwards, Luis. Now, on a Cartesian coordinate system, on the x-axis, the y-axis, and the z-axis, if your spine is biomechanically correct, you will be symmetrical from side to side and front to back, and you also will be lined up biomechanically correct on the x-axis, the y-axis, and the z-axis. Now, he's way forward on the z-axis with his head. There's your ear dropping all the way out here. See how that kind of pulls your shoulders forward and puts your hands out in front of you? And then down here, you've got room over here on this left side between your arm and your hip, and you don't have any over on this right side, so your pelvis has translated to the right on the x-axis, while your head's forward and right on the x-axis and z-axis forward. So I'm going to have you sit right here and face that wall. Now, these tests are really important orthopedic tests, and they're called maximum foramina compression tests. So if I push straight down on his neck like that, that hurt right down here, didn't it, Luis?
On that side.
So see if I go backwards and left and down, that really hurts, doesn't it?
Yeah, right.
And does that shoot pain down into your shoulder and arm more?
It does.
And if we go back and left and down, that still hurts over here.
On that side.
So that's called a maximum foramina compression test. Now this is interesting here. If I lift his skull straight up in the air on the y-axis, does that feel better, same, or worse to this area?
It feels better.
Okay, so that's a distraction test, and that's positive because it gave him relief, which shows specifically that the vertebrae, the facets themselves, are misaligned or subluxated, and is causing an encroachment on the intervertebral foramina where the nerve comes off the spinal cord out through the cervical brachial plexus down into his left arm and all the way down into his hands and fingers. So I did muscle testing on him also. I'm going to push down, resist. He's 5x5 on his deltoids. I'm going to biceps, pull out, triceps, push in. Biceps, pull out, triceps, push in, good. Now, I've already done these tests on him, so I'm just redoing them for your benefit here to show you a couple things diagnostically. Just relax it. There you go. He's got 2+ equal and active reflexes, upper extremity, biceps, triceps, and brachioradialis. And he's had the CT scan done on his brain. Now, he's got a low patellar reflex. Go ahead and look up for a second. Low patellar reflex on bilaterally here. He has a little bit of an Achilles reflex, but his patellar reflexes are a 1, and that's lower than a 2, which should be. So let's go on your tummy for me here, Luis, right here. So you probably all have noticed, and maybe some of you have seen this video that came up online. I just saw it this weekend for the first time. Some chiropractor called Dr. Jason or Dr. J something or another did a video, and he says, what is a ring dinger? But he's doing it on a model, not actual patient. That's tender right there too, isn't it? And right there. So this is a palpatory exam. His left leg was short by 1/2 inch. He got even when I brought it up and tightened up in his lower back and thighs. It's tender right here, all through here, huh? All the way up into here. Now, as I'm palpating his mid-thoracics, he's got a dished out area right here in his upper and mid-thoracics. Those are all tender, aren't they?
Yes.
And see, he's got rib misalignments at the costovertebral junctions of joints, and then he's got bilateral trigger points in his trapezius muscles, levator scapula, and rhomboid muscles. And he's really subluxated on the left side there at C6, C7, which is where he's pinching on the brachial plexus, right there on the right at C4 and 5. And we're going to have you lock your right leg straight and lift that whole right leg up. Okay, relax that one, do the left one now. And see, it was harder for him to raise his right leg up, so he has a right sacral deviation, even though he's got a left SI joint subluxation. So we're going to get him his first Johnson non-specific full chiropractic adjustment. Now, I do have specific intention with my adjustments, contrary to Dr. J. Bird's video, saying that I didn't have a specific intent. My specific intent is to adjust every joint so that it sends a neurological proprioceptive impulse through the preganglionic and postganglionic afferent and efferent nerves, through the lateral spinal thalamic tract up into the brain cortex, because the brain's the only part of the nervous system, central nervous system, that perceives pain. You might be having low back pain or neck pain, but where the pain is actually at, it's in your brain. And I'm not saying that you're hypochondriac, that it's all in your head. I'm just saying that's where pain is registered, is in the brain. So with the adjustments that I am doing on every patient, but you notice I do the same techniques on every patient because I want to stimulate the sympathetic and parasympathetic autonomic nervous system, the central nervous system, the brain and the spinal cord, and the peripheral nervous system, which is the cervical brachial plexus in this case, and the lumbosacral plexus down here. So I'm adjusting his cervical spine P to A here at C3-4, and then down here at C5-6 and C6-7, I'm adjusting P to A, and then down to T1 to bring his whole head back up over his shoulders. Good. Okay, let's turn you on your back now, Luis. So I'm going to bring your head up and back over your shoulders where it's supposed to be. Good. Now let's put both arms out. And even when I'm adjusting the extremities, I'm getting a capsular ligament stretch through the paraphysiological space that sends proprioceptive neurological information into the cerebellum and retrains the loop between the cerebellum and the different body parts that I'm adjusting. Okay, you can relax your hands on your tummy. There you go. Now you should have felt that from your knee all the way up to your pelvis and low back. There you go. Good. Okay, let's sit you face that way. You know, like I said earlier on my video, we love specific chiropractors. Because just like Luis says, there's a zillion chiropractors out in Irvine, California, isn't there, Luis?
There are.
There we go. Good job. You feel both those shoulder joints moving?
Yeah.
So see, he sees specific chiropractors, and tell them the reason you came all the way here to Houston to see me.
It's not getting the job done. I still have the pain.
Tell them what they do on you and what they tell you.
They typically tell me to ice it. They will do what I call a regular chiropractic adjustment, where they twist the back, twist the neck, press on my upper back and say that it'll get better.
There it is, right there. Oh boy, he sounded off like the last guy's shoulder did. Okay, let's come over here. And we're gonna lay you on your back on this table, pelvis there. And I'm really the only one that can authoritatively tell you what is a ring dinger. Go ahead and slide up a little bit under there, because I'm the only one that does it.
I just saw that video.
Did you?
Yeah.
Where the guy's talking about what is a ring dinger?
Yes.
See all the comments on there? One guy made a comment, I'm watching this as I'm flying to Houston to get a ring dinger. See, his reflexes in his patellar still aren't that great. Yeah, I know those are tight. So what I'm specifically doing with this ring dinger, and what a ring dinger does, is it decompresses the spine on the y-axis from the occiput all the way down to the lumbosacral joint, which is L5S1, to the sacrum. I'm wrapping the towel not around his neck, but I'm cupping it at the occiput, around his mandible. Just breathe through your nose. There you go.
Oh.
Yes, sir.
Ooh.
Home run.
Oh, there it is.
That's it. That's why we call it ring digger. Now looky there. You got a little bit of a reflex. You didn't have any before. Okay, just relax your neck in my hands here. Now this is that left side. I'm going to get at C6, 7. So I do adjust specific vertebral levels, like I'm adjusting C3, 4 now. There you go. Boy. But when you do a chiropractic adjustment, it fires off preganglionic and postganglionic, afferent and efferent neurological impulses through the spinal cord and up the brain and then back down to the body. Okay, let's get up sideways and stand over here in front of the mirror. And I'm going to have you close your eyes again and bend your head forward and backwards again. Oh boy. Wow, look at the difference already. So you're standing up straighter. Pull these up and back. We're going to bring that head here. And then like this, you're going to feel a little tap right there. I'm adjusting his atlas now, specifically on the x-axis that sends neurological proprioceptive information into his cerebellum. The cerebellum controls balance, posture, coordination, and all kinesthetic movement throughout the body. You can relax. Bend your head forward and backwards for me again, Luis, and tell me if this feels any smoother to you.
It does.
Take a look in the mirror right now. Remember you didn't have any space over here before?
Yeah.
You see it now?
Yep.
It's even with this one now.
It is.
Yep. So you know what? This Dr. J. Bird, he used a model on his to do his video about my ring dinger. You're a patient, not a model, right?
That's right.
And this is your very first adjustment here at Advanced Chiropractic Relief, and you've been to these other so-called specific chiropractors.
I have.
So tell our YouTube audience from your own words, and we haven't rehearsed any of this, have we?
We have not, no.
What is your opinion of how I just adjusted you with the Johnson Comprehensive Full Body Technique versus what you've had done previously?
I felt everything move. Everything that you touched had a purpose, and I feel a lot better.
And that's the purpose of the Johnson Chiropractic Technique, is that it works. It makes people feel better. You know, I'm gonna use this analogy. It's kind of like setting the master reset button on a computer. You know, if you got a crash on your computer, you have to shut it down and reset it, and sometimes you have to put a whole new hard drive in it. But he doesn't need a new hard drive, he just needs a reset. And this is a master reset. And if you only adjust this circuit breaker, or this circuit breaker, or this circuit breaker, you're missing the master reset. And that's what I'm doing when I do the Johnson ring dinger, the BioPhysics adjustment, and adjust on the x-axis, the y-axis, and the z-axis here through here, is I am resetting the neurophysiological proprioceptive afferent and efferent preganglionic and postganglionic fibers so that the body can function at a much higher level of efficiency. And did it feel better than what you had?
It felt a lot better.
Okay, good. Thank you.
It felt great.
This guy's name, I think, is Dr. Jason, and he says, "What is a ring dinger?" That was the title of his video. I caught that in watching videos before I went playing golf on Friday, and I found it interesting because he said, he's saying, "What is a ring dinger?" But he said he had to go look it up.
That's right, he did. I said that.
Yeah,
I saw
that's
that.
the very first thing out of his mouth.
Yeah. I thought he was going to do it on that girl, but like you said, it was a model.
You know, most chiropractors don't like the ring dinger, and a lot of chiropractors' offices, everybody's coming here and going, "Can you do a ring dinger on me? Can you do a ring dinger?" Now, they hate that most of the time, so that's why most chiropractors do not like me, is because a lot of our patients, or a lot of their patients, come in wanting the same kind of adjustments that I do on people, because I'm doing the master reset. So we're changing people's lives by affecting their nervous system in a monumental way, from the brain, central nervous system, the autonomic nervous system, which includes the sympathetic and the parasympathetic fibers, and then the peripheral nervous system, such as the cervical brachial plexus, the ulnar nerve, the radial nerve, and all the other. If I was to strip Luis down and take away every tissue in his body except his nervous system, I'd still be able to recognize Luis as Luis. That's how vast the nervous system is. So we're doing a master reset on your entire neuromusculoskeletal system when I adjust you this way. And it felt pretty good, huh?
It felt great.
Good.
I was impressed.
So did it meet your expectations?
You exceeded my expectations.
All right, great. Thank you for sharing your experience with
much.
everyone. This is your Houston chiropractor coming to you from Advanced Chiropractic Relief in Houston, Texas, where we practice pure chiropractic care, adjustments, pure and simple, hardcore chiropractic. We'll see y'all soon.